Hello everyone, I'm Mr. Furlong, and today we're talking bone remodeling. Our body is constantly making new cells. We talked about in a previous chapter about how new skin cells are made, for instance. Well, the same is true for things like bone cells. The skeleton that we have now is not exactly the same skeleton we had years ago. We're constantly getting rid of old bone cells and making new ones. This process is known as bone remodeling. And it goes a little something like this. Osteoclasts, which are these bone-destroying cells, are going through and they're carving out tunnels in old bone tissue. Then the osteoblasts, remember these are the bone cells that are going to make new bone tissue, will rebuild those areas that have been destroyed. Seems kind of weird that we would destroy the old bone tissue, but remember, whenever we make new bone tissue, that bone is going to be stronger than the older bone tissue was, thus making our bones stronger. Now, one of the things that can increase how often bone remodels is stress. This is why exercising is so important. The more stress we can put on bones, the more remodeling that will take place and the stronger the bones get. Bone remodeling, of course, requires calcium, and that's what helps to make our bones stronger. Let's look at an example of this. Here is a femur bone. This is what's called the head of the femur. This is the neck of the femur. And there's a lot of stress going on right here. Now, the femur will articulate with what's called the acetabulum. It looks a little something like this. When we are walking, of course, we have muscles that are attaching to all of this. And a lot of stress is being put on the neck. Get a close-up view of the neck here. A lot of spongy bone in the neck. So you may have, maybe you know someone or you've heard of this where, especially when someone is elderly, they fall and they break their hip. Well, a lot of times what's happening is they don't fall and break their hip. They're walking and the neck breaks because of the amount of stress and they fall. So really a better way of saying this is that they break their hip and then they fall. So by exercising now, taking in lots of calcium, you're going to make this bone extremely strong that will prevent things like that from happening in the future. Another place where a lot of stress is taking place is in our knees. The bottom of the femur, the top of the tibia receive a lot of stress, and so about every 6 months or so that bone tissue is going to be brand new. So what are some things that can affect how our bones are growing and repairing? Well, one is having a good nutrition. Vitamin D is needed for calcium absorption. Now, vitamin D is made when we go outside and the sun helps to change some of the cholesterol that's in our blood and it changes it into vitamin D. Of course, we don't go outside a whole lot, not like we used to a few hundred years ago. One place that we get vitamin D is in milk. They add vitamin D to that, which makes sense because that's where we can get quite a bit of our calcium. There's also a hormonal aspect to this. So growth hormone is needed for bones to grow. Makes sense, right? And so the more growth hormone you have, the longer that the bones can end up growing. Sex hormones can also influence this. Typically things like estrogen and progesterone will cause the epiphyseal plates to seal up sometime between the ages of about 18 and 22. So ladies, the closer you get to 18, the greater the likelihood is that you're about as tall as you're going to get. For guys, that's going to somewhere between the ages of 22 and 25. So you still have a couple more years to grow yet. And then, of course, there is exercise. We want to put stress on those bones. That's going to help the bones be stronger as we get older, particularly for women. One type of bone disease that women get is osteoporosis. So this is when bones become brittle and weak. Here we see spongy bone tissue. This is what it should look like as we look at it up close. In people that suffer from osteoporosis, this is what that spongy bone tissue looks like. Notice how much thinner the bone tissue is, which just causes it to have a greater chance of breaking. And the older you get, the more difficult and the longer it takes to heal from a broken bone. Now, why do some people get osteoporosis and others don't? Well, the cause is unknown, but we know that somehow the remodeling process is getting disrupted. So typically the more bone density you have by the age of 30, the less likely you will suffer from osteoporosis. So you still have a good 14, 15 years left to be exercising, getting plenty of calcium to make those bones stronger and stronger. And there you have it, bone remodeling. I'll see you in class.